to medical practice in Nigeria. And so we need to encourage the private practitioners. Please, can we put our hands together for our president? Thank you. Thank you. Thank you very much. We'll be entertaining our guests to African tunes. But before then, I'd like you to look at the quality and the substance of our guests on the high table. Nigeria must work, because I can't understand where we have such highly sought after guests, globally recognized guests. Is it our former Senate leader, Ken Namani? Is it the NLC president? Look at our guests, and we continue to have this. Nigeria needs to work. And it's going to be the effort of each and every one of us. Please, can we put our hands together for members of the high table, please? Okay, so we're going to pause with the cultural troupe so that the President, Nigeria Labour Congress, Comrade Adams Waba, would make his remark. Please, can we put our hands together as we invite him on podium? Thank you. Sorry, that was a little mix-up. The NLC president is still with us and is going to be with us. He's going to be with us for a very long time. Our guest that has other function to attend to is the SGF. Please, can we put our hands together as we take the remark of the SGF? Thank you.
Thank you very much. Good afternoon, dignitaries and also my colleagues that are here. Sincere apologies. I have a scheduled function to attend at 1, and it's very important. It's regarding the COVID-19 surge. As you are aware, the third wave is rising and peaking, and we have to do a lot to protect our country. So sincere apologies for interrupting the program because I have to attend to that meeting. My name is Mukhtar Mohammed. I'm the National Coordinator for the Presidential Steering Committee on COVID-19, and I'm hereby representing the Secretary to the Government of the Federation and Chairman, Presidential Steering Committee on COVID-19. The SGF would have wanted to be here, but last night he told me I have to attend because he also has other council issues to attend to. Before I go into the speech and the protocol, let me assure the chairman and members of the AGPMP that your prayers, I have heard them very well, and I'm going to take them to the SGF. As a medical practitioner myself, and I feel free, to speak my mind to my colleagues. Certainly, our healthcare system has a problem. And the solution to the healthcare system in Nigeria, actually the future of the healthcare delivery in Nigeria, is in the private sector. Government cannot continue to take along all the responsibility, and we know that the private sector has a lot to offer, and government will therefore do whatever is necessary to provide the support that will ensure that the private sector, the private medical practitioners, actually play their responsible role. Our profession is a noble profession, and it is beyond what we gain as salaries or to ourselves. As the chairman mentioned, or the president mentioned, our service is to humanity. We are at the expense of ourselves and at the expense of our family. It's like when you have a dedicated father who wants to take care of his children, but he doesn't have the means to do it. He will constantly reassure you that I will do the best for you. Meanwhile, his ability to do that is actually limited. Or when your house is leaking or is about to collapse, and you have the father run away from the house, leaving the household to suffer while he jets out of the country to go and take care of himself. Our profession is beyond that. It is a noble profession, and our service is to humanity. While we are doing that, we also ensure that we take care of ourselves and we take care of our family. So, Chairman, distinguished Senator Ken Namani, a very respectable politician, gentleman, a leader, and a role model for all future politicians in the country. The President of the Association of General and Private Medical Practitioners, Dr. Ike Ode, Executive Governor of Ekiti State, ably represented by my friend, Dr. Banji Filani, the Chairman of the Nigeria Labour Congress, Mr. Ayuba Waba, my older brother who sneaked into this place but was recognized and brought onto the high table, former Honorable Minister of State, Dr. Aliu Idi Hong. Ladies and gentlemen, I'm reading the goodwill message now by the Secretary to the Government of the Federation, Boss Mustafa, on this occasion of the one-day roundtable dialogue on private sector intervention in healthcare. I am deeply delighted to be here with you on this auspicious occasion on the private sector health dialogue and the launching of the 10 billion private sector healthcare intervention project implementation fund. Let me use this opportunity to commend the private medical practitioners of Nigeria and the organized private sector players for organizing this strategic and historic intervention, especially now that the health systems of the world are overstretched. It demonstrates your deep understanding of the challenges of the Nigerian health environment and your unreserved commitment to the fatherland in supporting government efforts to improve and revitalize the sector. Undoubtedly, Nigerians are found among the best medical practitioners anywhere in the world, and we are proud of you. On behalf of the President of the Federal Republic of Nigeria, President Muhammadu Buhari, I wish to also commend you all for your faith in your country, that at a time when many of our colleagues are jetting out to other countries in search of greener pastures, you have decided to stay back to support the entire health system of Nigeria to bring it to the global best practices and standard while encouraging private sector participation. Despite the fact that the private sector doctors operate under unfavorable environmental conditions, such as multiple taxation, exorbitant public utility tariffs, non-subsidized import duties for medical equipment, among others, you have continued to strive and support the health and well-being of Nigerians. These, your efforts, are greatly appreciated by our government. It has also been demonstrated here today with the launch of the 10 billion fund to implement the Save 1 Million Nigeria Mothers Initiative, Mobile Health Solution, and the Awake Nigeria Project, Project 2030. In this same vein, the Office of the Senior Special Assistant to the President on the SDGs decided to respond to the challenge by taking the initiative to construct mother and child centers and strategic partnerships across the country. These initiatives will definitely promote the health of the mothers and children, reduce maternal and child mortality, and of course, help improve Nigeria's poor health indices. Distinguished ladies and gentlemen, I wish to categorically inform you today that Nigeria's health security has been strengthened. With the arrival of COVID-19 and the unprecedented amount of effort and coalition placed by our government to strengthen surveillance, provide more healthcare facilities, particularly strengthen our intensive care units, establish oxygen plants, support more healthcare beds and turnaround for time of testing and detecting other diseases, and further inclusion and involvement of private laboratories in public health response. Despite the impact of COVID-19, we've strengthened and increased market access, facilitation for targeted women, and youth in micro, small, and medium enterprises. The federal government social intervention programs have continued to reach out to millions of vulnerable children across Nigeria. Let me re-emphasize the commitment of government towards the formulation and implementation of favorable policies that will be beneficial to the Nigeria's health sector, as I invite you to be part of the Universal Health Coverage 2030, because only an inclusive sector can produce the desired result. At this juncture, I wish to congratulate the private medical practitioners of Nigeria and the organized private sector players on your centenary celebration, and thank you for choosing to use this season to refocus on the state of our healthcare by taking up measures and support government in addressing the challenges of maternal and infant mortality in Nigeria. I have heard the prayers from the President and will convey it to the SGF, and also look forward to the resolutions that will come out of this important workshop to guide government in our policy implementation. I thank you all for listening and wish you a successful celebration. Thank you.
Ladies and gentlemen, we deeply appreciate the remark of Dr. Mukhtar Mohammed, the coordinator, Presidential Task Force on COVID-19, representing the Secretary to the Government of the Federation, Mr. Boss Mustafa. Thank you so very much for coming. Thank you, sir. God Almighty bless you. Ladies and gentlemen, permit me to recognize the presence of Dr. Leostan Eke. Dr. Leostan Eke is the chairman, Zynos Technologies and Conga Group. He is very ably represented by pharmacist Cornelius Umanzi. Please, wherever he is, thank you so very much for coming. Ladies and gentlemen, earlier I told us about Professor Owunari Georgewill, the brand new Vice Chancellor of the University of Port Harcourt. He's here not just a professor, but he's here as a medical doctor. Professor Owunari is a professor of pharmacology. Please, can we put our hands together as we appreciate him one more time? Thank you. Please, our convenience is left and right at the entrance. Thank you. Ladies and gentlemen, the next distinguished Nigerian that I will be bringing on stage, on the podium, to make his remark is one man that has stood for the welfare of so many Nigerian workers. It's not been very easy, but we'll appreciate his doggedness at always addressing our issues. But before I bring him up, I'd like to inform us that this program is currently being live streamed on Zoom, Facebook, and WhatsApp. It's live. We're going to connect and then you'll be able to view yourself. It's a global program. Wherever anybody is, such a person can connect to what we are doing here. Thank you so very much. Ladies and gentlemen, please can we put our hands together as we invite on stage the President of the Nigeria Labour Congress, Comrade Ayuba Waba, to make his remark.
The chairman of this very important occasion, His Excellency, the former Senate President, distinguished Senator Ken Inamani, GCON, a great Nigerian that have earned also the confidence of Nigerian workers. The President of AGPMPN, the Secretary to the Federal Government, ably represented, my other colleagues on this side of the table, esteemed participants and other guests, good afternoon. Let me start by congratulating the Association of General and Private Medical Practitioners of Nigeria on the commemoration of your 100 years of existence. This is no doubt a worthy milestone. This epochal moment provides us the space to recall and celebrate the contribution of private medical practitioners to the sustenance and enhancement of Nigerian healthcare delivery system. You have also contributed to other areas of national development, especially the civil activism, through people like my very good friend and colleague, Dr. Beko Ransom Kute of blessed memory, and Dr. Oke Polorumo and others. The occasion of today certainly is very important because, as been said, health is wealth. And a healthy nation certainly is a wealthy nation. And that is why some of the indices that are used to measure development around the world are health indices. Issues of maternal mortality, issues of infant mortality, life expectancy, and the likes are issues that certainly are issues that are within the domain of healthcare delivery. No doubt, the challenge of COVID-19 has exposed the inadequacies in our health system. And I think all of us are aware of those inadequacies. There is no one who will be discussing the issue of attaining universal health care if the issue of health financing is not addressed. The issue of human resource for health, having the necessary health professionals in all sectors, be it in the rural areas or in the urban areas, in appropriate profession that can be able to address our challenge. And lastly is the issue of technology and even medicine. Today, all of these issues are seeking for solution. And I'm happy that part of what this roundtable is looking at is how the private health sector can intervene in addressing these myriad of challenges. And therefore, really, I want to commend your association for standing up to address these challenges and also providing solutions. We will continue to partner with you because NLC as a pan-Nigerian organization have played also a major role in the past in healthcare delivery. And let me make the point very clear that the success today of the current National Health Insurance Scheme can be attributed to the NLC. In fact, workers in the public sector forfeited their 10% medical allowance, which was the seed money used up till today to actually create the funds that are being used by the National Health Insurance Scheme. Not only that, the president of the Nigerian Labour Congress at that point in time launched the public sector health insurance scheme with that seed money. So it's to tell you that we will use our number, we will use also our abilities to support this noble cause because we realize that we, the masses, because we are part of the masses, that toil to build the economy of this country are also people that are suffering from the inadequacies of the health system. How do we take care of the poor and the less privileged? How do we address the issue of the most vulnerable in our society for them to access quality health care? Certainly, the issue of financing must come in. That's why this noble initiative from the incentive, I've said that I will be here personally to support this initiative. We'll also give our support to make sure that this initiative succeeds. I have seen the passion with which the president tried to put the issues to all of us. And I want to say that part of the issue is that we must also continue to take responsibility. Our political elites must take responsibility. How can we be discussing such an important issue that those ministries that are very key in implementing government policies and programs are not here? This is very important for every Nigerian, the delivery of quality health care. I know that in the Ministry of Health, we have 2 ministers, permanent secretaries and others. This is the core function of the Ministry of Health. It's their core function. And I expect that they should be here and we should say that without mixing words. We should talk straight for us to address the challenge of this country. There is no reason whatsoever for any of them not to be here to listen to what we are going to say and to see how we can fix this mirage of challenges. It's unfortunate that as we speak here, even our resident doctors are on nationwide strike. And that, to me, is avertable. We can avert it if there is dialogue, if we promote social dialogue, and if the outcome of social dialogue is respected, implemented, and if there is actually a window of opportunity for also private medical practitioners to come in and also contribute their quota in the overall development of our healthcare system. So for me, I think is an issue that is very important and will continue to support all of us. I mentioned the issue of how do we even retain the few professionals that we are training. It's obvious that we must take care of them. I've visited many countries around the world, more than 60 countries. And the last one before the COVID was actually the United States, where I visited St. Petersburg. I visited the hospital because I'm also from the health sector. And what I saw was very interesting. In fact, they just recruited few Nigerians. And do you know the rugo people go through even to be employed outside the country? I was asking a lady that was a nurse from UCH Ibadan that was just employed newly at that hospital. How do you get employed? She told me they had to go to India because the recruitment agents are in India. The recruitment center is in India. You have to pass their exam there in India. They have to go a process of training and retraining for 6 months before they are recruited. And I was asking, I was interested. Why do you need to leave the shores of Nigeria to come and practice here with all the risk and all the training that I've gone into? But well, she needed to take care of her family. So invariably is in search of greener pasture. I was very interested and I had to follow her to her house. I saw that she was given a house. She was given a new car, which she will pay over a period of 2 years because there is a bond. And after that period of 2 years, she's at liberty to go and seek for other employment opportunities. This is why many Nigerians, professionals, leave the shore of this country. And we spend a lot of resources to train them. This must stop. The issue of medical tourism must stop because we have all it takes. The resources that God have endowed this country, we have all it takes to fix the challenges of this country. And therefore, I'm in support of having a fund that can actually address the challenges in our health sector. This fund should be assessed both by both private and public health practitioners. This is the only way we can be able to bridge the gap. And I agree that it should actually be a fund that can be assessed with less than one digit actually interest rate. This is the way to go. If not, it will be difficult for even the private medical professional to fill the wide gap that exists in our healthcare delivery system. So once again, I bring you a very warm felicitation. I want to also support this wonderful initiative. And I want to assure you that the NLC and our 49 affiliates will continue to stand by this very noble initiative and will try to push you and support you. Thank you very much.
Ladies and gentlemen, please can we put our hands together for the President of the Nigeria Labour Congress, Comrade Ayuba Waba. Thank you very much. Thank you, thank you, thank you very much. That is the man, Comrade Ayuba Waba. He says it as it is. I told you our speakers have been carefully chosen for today's event, and we have more of them to interact with us. Ladies and gentlemen, permit me to recognize past leaders of AGPMPN that are seated here. May I have the honor of recognizing Dr. Gabriel Oga. Dr. Gabriel Oga is a past president of AGPMPN and is also a member board of trustees of AGPMPN. Thank you so very much. Ladies and gentlemen, a past president of the AGPMPN also, may I recognize Dr. Anthony Omolara. Dr. Anthony Omolara is a past president of our Nobu. Omolara, sorry, is a past president of our Nobu Association. Please, he stands to wave to us. Thank you, thank you, thank you very much. Doctors know everything, everything. What doctors don't know, they call it idiopathic. That means we know it, but we may not know it now, but we know it. And one thing that was very challenging to doctors was the cancer nomenclature. Getting the name cancer, breaking the news to patients that you have cancer. Doctors discovered that it was not even the pathology that was associated with cancer that was killing patients, but the news that you're going to die in 2-3 years was enough, and it was killing patients. And doctors met all over globally to making sure that they gave it a more appealing name instead of calling it cancer. And when they met, they now changed the name from cancer to carcinoma. And when they break the news to patients, it was some form of relief, because at that time, patients didn't know that carcinoma was the same thing with cancer. But it didn't take long, and patients discovered that carcinoma was the same thing with cancer. They now met, and they changed the name from carcinoma to metastatic lesion. And patients did not know until it took patients a very long time to know that metastatic lesion is the same thing with cancer. They now met again and changed the name from metastatic lesion to mitotic tumor. And for a very long time, patients were at home with that name. But with the coming of internet, they discovered that mitotic tumor was the same thing with cancer. It was terrible until the last meeting of doctors globally. Our foremost medical practitioner, Professor Adewale, was in that meeting. Our vice chancellor was also in that meeting. And they changed the name from mitotic tumor, and they are now calling it CA. Except you go and tell patients, up till now, patients don't know that CA is the same thing with cancer. They think CA is continuous assessment. Ladies and gentlemen, it is a gathering of medical practitioners, private medical practitioners, and we are celebrating 100 years of existence. Please, can we put our hands together for ourselves? We're going to take interlude of music from the Umoma Cultural Troupe. Umoma Cultural Troupe, if you are ready, we are ready. But before then, permit me to recognize the presence of Sir Emeka Offor. Sir Emeka Offor is the chairman of the Sir Emeka Offor Foundation. He's ably represented by the programs officer, Mr. Onu Peter. Thank you so very much for coming. Thank you. Permit me also to recognize the presence of Dr. Aminu Mohammed. Dr. Aminu Mohammed is the managing director and CEO, Venus Medicare Limited, ably represented by Dr. Chidi Ubogulu, Chief Operating Officer. Please, if you're here, just wave to us. Thank you. Thank you. Thank you very much. Umoma Cultural Group, you have the floor. Thank you, thank you, thank you. Thank you very much. Thank you, thank you, thank you, thank you very much. Thank you, thank you, thank you, thank you. Thank you, thank you, thank you. Thank you. Please, can we put our hands together in appreciation for the Umoma cultural troupe? Thank you. So much message being preached in their performance. Thank you. Representing the very rich culture of Nigeria, Fulani tribe. Thank you, thank you, thank you. We have a crowded agenda. Thank you. Thank you, thank you. Please, can we put our hands together for them, please? Thank you. I hope you got the message from the performance. Thank you. Ladies and gentlemen, permit me once more to recognize the presence of Dr. Ekene Ekena. Dr. Ekena is the Managing Director of Ekena Natures in Enugu. Please, if you are here, thank you very much. Thank you, thank you. Ladies and gentlemen, lest you forget, it's the AGPMPN one-day roundtable dialogue on private sector intervention in healthcare in Nigeria. And we also aim to achieve a 10 billion naira fund launch for Save 1 million Nigerian mothers initiative. Thank you for your patience and your solidarity so far. Another guest that will be bringing to the podium to interact with us. Ladies and gentlemen, the chairman of the Nigeria Governors Forum, very highly intellectual being, warm greetings from Ekiti State. Permit me to recognize and usher to the stage His Excellency Dr. Kayode Fayemi, CON. Please, can we put our hands together as we take his remark? Very ably represented by the Honorable Commissioner for Health in Ekiti State, Dr. Oyebanji Filani. Please, can we put our hands together for him, please? Thank you. Thank you very much.
Let me start by appreciating the group for the very rich display and representation of culture in the dance. And secondly, to appreciate everyone here for maintaining the safety protocols and adhering to standards, given that Nigeria is currently moving towards a third wave of the COVID pandemic. I'm here on behalf of His Excellency, Dr. John Kayode Fayemi, to deliver this goodwill message. The chairman of the occasion, distinguished Senator Henry Namani, the representative of the Secretary to the Federation, the Labor Union President, representative of complementary and alternative medicine, my former Minister of State and Senior Policy, and of course, the dynamic AGPMPN President. It is with great pleasure that I deliver this goodwill remark on this important landmark, centenary celebration of the Association for General and Private Medical Practitioners of Nigeria. I would like to start by congratulating the association for this great milestone. It is indeed a worthy celebration. The role of the association as providers of healthcare delivery is such a critical one, given that 60% of health service delivery is offered in the private sector here in Nigeria. It is therefore important to ensure that we work together in order for us to be able to deliver on our goal for achieving universal health coverage. The challenges in the Nigerian health sector are all known to us. So unlike doctors, I will try as much as possible not to hide it under ambiguous terms like CA or metastatic lesions, and we'll avoid dwelling on them, but try rather to speak about the road to recovery, especially in the light of prevailing realities caused by the COVID-19 pandemic. It's been a year and 5 months since COVID-19 changed the world. From seemingly simple behaviors such as regular hand washing to the other extreme such as lockdown and travel restriction. This small virus has made the world, and indeed Nigeria, realize that we are just one disease away from global destabilization. Before the pandemic began, we had set several milestones for ourselves, including achieving UHC by 2030. Yet, we're faced with a sad reality that COVID-19 has disrupted health systems and economies. In less than 2 years, the pandemic has caused a setback in development gains achieved over the last 25 years. Across the world, we've seen the impact of this pandemic on the livelihoods of people. And as a country, we're experiencing our worst, we're just getting out of one of the worst recessions we've ever had. The limited fiscal space at the federal level has affected states, and as such, we've had to adjust our spending and priorities to ensure that we stay afloat. These prevailing fiscal realities have adverse effects on the poorest of households. But while we mitigate the immediate consequences of the pandemic, we must also focus on building back our economy and health system for tomorrow. An economy and health system which is resilient to health crises and economic shocks. By prioritizing recovery plans that tackle multiple challenges, Nigeria can recover in a way that is more inclusive, sustainable, and resilient. I've used the COVID-19 pandemic as an example to show us how diseases and weak health systems can destabilize lives and economies. Now to the solution. What do we need to do as a government and as citizens? I would speak on 3 critical areas. The first, increase investments in health security. Neither individual governments nor the global development community can entirely prevent the emergence of diseases. However, we can be better prepared by strengthening our health system through investment in health security. Investing in health security not only saves lives, but is also a vital investment in the wider economy. In Ekiti, for instance, we have taken advantage of the COVID-19 pandemic to strengthen our public health security. We have decentralized testing to 145 testing centers, the highest in the country, and improved our disease surveillance capacity to pick up early signals of possible outbreaks. Investing in the capacity of health workers. There is obviously a need to address the challenges in human resources in health. Challenges in training, continuous professional development, amongst others, should be prioritized and addressed. The quality of our health workers certainly reflects the quality of our health system. It is therefore pivotal to invest in continuous capacity improvement. In my state, for example, Ekiti, we're focused on redistribution, capacity building, and reward of our healthcare workforce. At the primary care level, for instance, whereas this time last year, 50% of our nurses and midwives were spread across only 5 of the 16 LGAs, we have now redistributed our nurses and midwives within the senatorial zones to ensure a more equitable access to skilled hands. We have also trained over 30% of our existing primary healthcare workforce, with more scheduled to be trained this year. We now recognize standout performances and celebrate our workers monthly. We're very much aware that these non-financial incentives have proven to be powerful motivators in the workplace environment. We're mindful that beyond redistribution, certainly more needs to be done. In the last 1 year, we've recruited more than 20 doctors to support service delivery in our primary and secondary care facilities. We complemented these efforts by establishing an NYC Medical Fellowship, in which NYC copper doctors are actively encouraged to work in rural settings in Ekiti State. The fellowship was born out of the realization that in the past, more than 50% of copper doctors posted to Ekiti State relocated immediately after camp. Today, as I speak with you, we've managed to retain 99% of all doctors posted to the state since the advent of the medical fellowship. Similarly, we have developed a program to utilize services of doctors at our teaching hospitals to complement the existing staff at our general hospitals. This program aligns with our goal of increasing utilization in these facilities, with incentive payments to the doctors aligned with the composite number of patients seen. Our investments in infrastructure has moved away from building new hospitals to modernizing existing ones and providing the relevant equipment to work with. In addition, we have strengthened our drug management agency with a relevant enabling framework, and we expect in a short while that we'll have a more structured system that is aligned to global good practice. Given the investments we've made in human and physical resources, data measurement and use has become even more important. Only last week, we signed a partnership with a foremost electronic medical records solutions provider to enable us collect, collate, and synthesize health records electronically and in real time. Health financing. To set our state on the right path and enable us match our ambition with our vision, we tripled our capital budget from 1 billion to 3.2 billion in 2021. In addition, we have deepened our public health financial management processes by consolidating donor resources into our budget. We have earmarked resources as well, fund a defined and explicit set of high impact services under our health insurance agency. This deliberate approach that we've taken to strengthening our health system goals have begun to yield fruit. Anecdotally, there's been an increased interest in the use of health services by households in the state. And latest data indicates that we have increased our immunization coverage rates to 86%. The journey to achieving our goals requires 1,000 steps, but we have taken necessary actions, mindful that, like Johnny Walker said, we must keep walking in the right direction. Before I round off my address, I would like to touch briefly on the ongoing strike by the NARD. Whilst the issues raised are relevant, the effectiveness of strike as a tool for negotiation are up for debate. As doctors, I would like to encourage everyone that our approach to labor and work-related issues must focus on compelling and irrefutable arguments that provide an opportunity to gain friends and sympathies across several industries. We will continue to work with you to ensure that we come to a meaningful conclusion and ensure that we are all able to get back to work as quickly as possible. As a bonus point, I would like to mention that there's a strong economic rationale for investing in health. I know it as a governor. Most of my colleagues now understand it given the COVID-19 pandemic. And we are mindful that healthier adults are more productive and our healthier children are more likely to remain in school. Investing in health brings measurable benefits to the nation, lifting many out of poverty and ensuring universal health coverage. Finally, I'd like to thank you and the association for the honor and for considering me worthy of the award. Once again, I want to congratulate the association for general and private medical practitioners on this landmark celebration. It is my hope that all the lessons shared at this event will be carried forward and implemented towards a healthy, resilient, and sustainable health system in Nigeria. God bless you all.
Thank you very much, Your Excellency, the Executive Governor of Ekiti State. and the chairman, Nigeria's Governors Forum, Dr. Kayode Fayemi. Thank you very much. Ably represented by the Honorable Commissioner for Health for Ekiti State. Thank you, thank you, thank you very much. Ladies and gentlemen, very distinguished guests, I'd like to very warmly invite to the podium a foremost medical elder, former Minister of State for Health. At least we thank God that we are able to have one of our ministers seated to interact with us and to chart the way forward for healthcare delivery in Nigeria. Ladies and gentlemen, please, we'll put our hands together for Dr. Aliu Idihong, former Minister of State for Health, to make his remark. Thank you.
Thank you very much. Your Excellency, the former Senate President of the Federal Republic of Nigeria, my boss and father, distinguished Senator Ken Inamani, GCON and chairman of this very important occasion, Secretary to Government of the Federation in absentia, the Governor of Ekiti State, ably represented by my brother, the Honorable Commissioner, my personal brother and comrade, leader, the President of LNC, Comrade Ayuba Waba, my President and President of this very important association of private medical practitioners in Nigeria, very eminent personalities here present, members of this very important association, members of the press, distinguished ladies and gentlemen. Sir, I want to share the views of the president of LNC, because these issues we are discussing here is cross-cutting, because it is health, it is about health financing. So we have loved to have seen central bank and commercial banks here. We have loved to see maybe finance ministry here, because they are the policy makers. And also health is not just a social issue now, it is a business issue. So it will not have been too much to ask for Minister of Trade and Industry to be here or his representative, because we want to have a solid foundation for funding healthcare system in Nigeria. Let me quickly congratulate the association on this centenary, because it is not easy to be a centennial-old association. Just like the chairman of the occasion have said, keeping together is very difficult, especially in Nigeria, because you find people coming together to form all manner of association. After a day or two, there is disagreement and they have fallen apart. But you have stuck together and stick together, and you are still waxing very strong. Congratulations for this very important milestone. I also want to say that we need to congratulate the members of this association, because truly speaking, after being a minister of health, I have the indices, I know what is going in this country. Conservatively, the healthcare provision of this country, minimum provided by the members of this association, 50% and above of the members of this country access healthcare delivery through the private practitioner at every level of this country. So without them, you could see conspicuously that government will have been in a major crisis without the private practitioners. So you have done very well in helping government doing its work and also helping the population of this country. I am very much concerned to come here because I share the vision of the organizers of this roundtable, because what we are seeing today, we need to change a paradigm for funding health system or the approach to health system. Governments we have already said, only sponsored healthcare, maybe 30, 50% from the state to the federal government to the local government level. So the remaining part of the population access healthcare through private care, and the doctors that provide this healthcare have not been taken into cognizance, maybe through grant, subsidy, or cheaper financing for them to establish and develop their contribution to the health sector of this country. I was worried and concerned more, especially with the advent of this COVID-19 pandemic and the way it totally grounds the whole world. All of us are witnesses that no matter how wealthy and how resourceful you are, if you are unfortunate to have been very sick in the past 1 year plus, if you are not lucky enough, you will have been dead by now, because those who think that healthcare accessing is outside the country, even if you have the citizenship of those countries, there is no available flight to those countries. For those who have the resources, if you have the means to get the flight, you don't have visa because those countries have closed their boundaries, so there is no entry no matter the emergencies. Even if you have the means for you to go there, the protocol required for you to move is so enormous to an extent, by the time when you finish, you are already dead. We are all witnesses to that in this current pandemic. So I think it is in the interest of Nigeria and in the interest of government for us to look inward. How do we support our own indigenous capacity? How do we augment the existing effort of the private sector so that at least they will close the gap of this health tourism that is always going out of the country? Apart from it helping the country in providing employment and providing healthcare to the country, we will also save foreign exchange, especially in this very serious financial challenge of the country. Conservatively, Nigeria spends minimum of $1 billion per annum for them to access healthcare in the form of health tourism. So if we are able to retain that amount of money, I wonder which type of economy will have been added to the country, the safety of the patients, and also, most importantly, the employment it will generate in the country. So, sir, let me convey my message to government through the chairman of this occasion, who will have access to the governor of the central bank and minister of finance and the SGF, that government have to deliberately create a private hospital funding fund. If it is not a bank, it should be created a special fund so that the private hospital can access. I didn't say healthcare foundation or fund, because if you say healthcare, the pharmacists and the other sector who are already businessmen will come and scoop the money before the doctors and the hospital realize it. So this money should be specifically for the development and promotion and expansion of private health hospitals in the country. It's not asking for too much, because they are doing the work for government, they are doing the work for Nigerian population. The good thing with Nigeria is that we have the population and we have the purchasing power. If you are able to provide the standard of the healthcare facilities that is available all over the world, apart from Nigerians being able to pay for it, there is also the possibility of the sister countries in the West African coast will have the possibility of coming into the country to access healthcare here, which will expand our economy in the country. Just like Mr. Chairman have said, and also the president of the association, sir, I have in the course of my life worked in a private hospital. It's not easy to build a hospital. It's not easy to run a private hospital. Most of the doctors you see here, sir, work minimum of 16 to 20 hours per day to keep the hospital running. Because even if you have the hospital, most of the people that goes to the hospital goes for the doctors. And if the doctor is not there, people will not come. So they suffer a lot and they don't have their own life. So what do? We need to have this cheap capital, because just like everyone have said, you cannot recoup the investment in healthcare in 2-3 years, like the other type of investment that you go and invest and recoup your investment in 5 years. To build a hospital, if you are going to do the work properly, you require like 20 to 30 to 50 years for you to have recoup your investment before you look for a profit. So there is need and the understanding that government have to support this initiative to create either a health bank or specifically hospitals development fund so that doctors can access to expand their hospitals, so that doctors can access the facility for fiscal infrastructure, upgrade their equipment, and retrain their human capital so that they will provide the type of facility that we are all going outside the country to access. Everyone have said the Nigerian health workers are well trained anywhere. That is why you go to America, you go to Saudi, you go to Europe, even the UK, where our trainers, you find significant number of their health manpower from Nigerian population. So if you are able to provide this window, I have every confidence that most of the doctors in the diaspora will also come back here and establish facility and provide that type of state-of-the-art facility and augment the support of the existing members here. So, sir, we are very passionate about this. What we are pleading is not asking for too much because we are asking to save ourselves. May God save us from another pandemic again. If another pandemic came again, you will find out that even if you are president or you are minister or governor, you can't move an inch. So it is in your interest to make sure that this system here works so that you don't need visa, you don't need aircraft to travel, you can access health. Secondly, I want to also advise doctors in the private sector. Apart from you doing social work, you are now businessmen. So develop your business model so that when you approach a financing agency, they know that this is a business model, this is an investment that they are going to get their investment from. It is not a charity work like most of us are thinking. So develop yourself properly like businessmen and also have your work plan properly so that if you are going to apply, I am aware there's a central bank sometimes awarded about 100 billion naira for healthcare funds. Before you say Jack Robinson, the pharmacists and the pharmaceutical companies have went and scooped the money. Actually, they require more than that. But because they are businessmen, they are fast, they were able to get their papers and documentation ready, they were able to access the money. Well, doctors were struggling to do up and down before they went there, the money has finished. So now we want a hospital development fund. To be conservative, sir, we need a minimum of $1 billion in 5 years annually that will be accessed for this hospital. And secondly, sir, thirdly, the agency should also compartmentalize themselves. Each zone should have a specialist center around the teaching hospitals and the Federal Medical Center, so that each center, which is a center of excellence, should develop similar type of private arrangement and in collaboration with the private sector and the teaching hospital and the government facility, so that they will augment the manpower and also the facility. If you travel abroad, you will find out that you cannot distinguish which one are you dealing. Is it a private hospital or is it a government hospital? Because certain time you will be in a teaching hospital, or certain time you are in a private hospital, or you are in a private hotel facility where you are being accommodated. In the same way, you are in a private facility, but a doctor from a teaching hospital will be invited to come and see you in a private facility. When it is beyond, then they will shift you to the teaching hospital seamlessly without anything happening. So there's need for us to develop this type of template here. And finally, also, I want to say, apart from us getting center of excellences at every level, there is need for the doctors that are running private hospitals to identify their strengths and their weaknesses, identify what they need to do, so that by the time when you get the funding and augment your strength, you will be able to say, if we say we need a cardiac center, that in 30 minutes, if you are able to be transported, they will put a stent in you and save you from cardiac arrest. That is the type of efficiency that we are talking about. If you have a cancer, it is not the old type of treatment. the doctors will treat you very aggressively the way, because the difference between our teaching treatment here and abroad is that when you go abroad, they deal in the state-of-the-art facility for the investigation. They give you the latest drug and give you at generous prescription. Unlike here, because of maybe financing or cost and go, people are looking. No, we have to have that, because if people are willing to pay, you should give them the best. So I think it is in the interest of the private practitioners to make sure that we now see ourselves as business people. We should forget about when we were seeing ourselves as social providers or charity organizations. If you want to survive, build a template. So, sir, Mr. President, please go and talk on behalf of our colleagues to the governor of the central bank. He is a very forward-looking and visionary leader. I am surprised he has not been able to be invited to this program. If he was here, he would share these visions we are talking about. But convey this information to him. He should collaborate with the commercial banks to make sure that private doctors that are applying for funds access funding. When we are saying less than a unit of the interest rate, actually for doctors, because it is a social concern, they should access funding less than 5%. Less than 5%, because they can't charge like you go to 5-star hotel and they tell you you pay anyhow. No, the patients are already, by the time when they come, they are challenged and the economy is going down. So normally they are a bit careful about how they charge. They are doing contribution to the country. So, sir, please talk to government, talk to central banks specifically, who is very forward-looking, and share this type of vision, because he has created different type of funding system for special intervention in agriculture, industrial development, and all manner of type of funds. This hospital one is important, just like you were saying. Apart from air and food, health is the next most important thing you need as a human being. So there is need. We are not asking for too much when we say we want him to create a health hospital development fund, so that existing hospitals should access funds to upgrade their facility, to upgrade their teachings and their human capital, and also new entrants should access funds to develop state-of-the-art facilities, so that when we are facing another challenge like the pandemic, God save us from it in the future, we will have no fear to be apprehensive about movement. Thank you very much, and I wish us all the happy deliberation.
Ladies and gentlemen, please we'll put our hands together for Dr. Aliyu Idihong. The energy and passion and commitment with which the former Minister of State for Health made his speech, you will know that he's committed to excellence in healthcare practice in Nigeria. We deeply appreciate you, sir. Thank you very much. Ladies and gentlemen, we're going to take a couple of remarks from our guests that are here, and we're already time constrained. So we're going to just allocate 3 minutes for a goodwill message from all of these guests. Ladies and gentlemen, the next that I'll be bringing to the stage. Okay, please, the National ESCO, we need you to have a photo session with His Excellency, the chairman of this occasion. The National ESCO, please, wherever you are, we need you to come up for a photo session. Then past president of our noble association, Dr. Anthony Omolala, and Dr. Gabriel Oga, who incidentally is a member of the Board of Trustees. Other past leaders of the association that are here, just join the photograph. Thank you. We still use this opportunity to appreciate the chairman of this occasion, our father, a leader, a dogged leader, a pace setter. He was here before most of us, and he has sat down gently and humbly listening to all the deliberations. To our chairman, His Excellency, distinguished Senator Ken Nnamani, we say thank you, thank you, thank you very much. Ladies and gentlemen, the next to make a remark is the Vice Chancellor, the brand new Vice Chancellor of the University of Port Harcourt, traveling all the way from Rivers State. I told you earlier, he's one of us, a professor of pharmacology. Ladies and gentlemen, please can we put our hands together for Professor Wunari George Will to make his remark. Thank you, sir.
Thank you. My dear colleagues, I want to say it's a great pleasure for me to be here. So when my classmate, Dr. N.S. Shukuma, who is the national officer of this association, came to me in the hotel to say this program is going on, I should be able to attend. I said yes. When I finished medical school, I was a resident and also a private practitioner. So I've been in both sides, I've been in both worlds. I want to congratulate all of us. I say us because I'm also a medical practitioner, both public and private. To me, since its founding in 1921, this association has become recognized as a very professional body which has committed itself not only to providing healthcare service in the private sector, but has grown to a body that is interested in research, in teaching and community engagement. Actually, when I started seeing conferences of this association, it gladdens my mind because I know that in our profession, there is no other way to grow than exchanging ideas and learning new things, innovations and so on. And so I'm very proud that we have highly committed and competent practitioners who have taken private medical practice to lofty heights. I'm even very confident that you will continue to play a significant role in providing increased access to healthcare. Because without you, I'm sure access to healthcare will be too low for us as a country. But your role has made access improve to many people who can now access health just because of you. I want to say that medical innovation and development are also key as you provide access through your various conferences. I'm sure you exchange knowledge so that we'll have more innovation. On this very special occasion, I would like to wish all of us a very happy centenary anniversary. And it is my belief that, God helping, this event will be fruitful and memorable. And I believe that for us as members of AGPMPN, God will continue to bless and grant us favors in all our endeavors. As a Vice Chancellor, I know that I'm a partner to what you are doing because I train medical students who will come out tomorrow. Some will join you, some will join the public sector. I wish you all the best. God bless you all. Thank you.
Thank you very much. Thank you. Thank you. That was a very warm message from Rivers State. Thank you to the Vice Chancellor of the foremost University of Port Harcourt. Thank you, sir. Ladies and gentlemen, without wasting time, I'd like to invite to the podium the CEO of MESAF. MESAF is a pharmaceutical conglomerate that has joined hand in hand with doctors to making medical practice feasible in Nigeria. Ladies and gentlemen, permit me to invite to the podium Ms. Vivian Nwaka to make her remark. While we wait for Ms. Vivian Nwaka, yes. Before then, I was about inviting our foremost professor, but he joined His Excellency for the outing just now. So immediately we are done with this pharmaceutical conglomerate, MESAF, who will take the remark of Professor Bade Adewale. Thank you, sir.
Hello, good afternoon, and thank you so much for having me here. My name is Vivian Nwaka, and I'm founder of MEDZAF. MEDZAF is a pharmaceutical platform helping hospitals, clinics, pharmacies purchase and manage your medications. We help hospitals and clinics with financing, and we also really specialize in quality control of medications. So we're looking to eradicate any possibility of fake or substandard medications, and we're helping pharmaceutical companies have the access that they need of information so that they can increase their offerings to Nigerians. I started this company in 2017 because I saw a need to invest in Nigeria's healthcare. Our motto is quality medication is a fundamental human right. And right now we work with some of the largest hospitals across the country. We have been dedicated to doing the hard work of finding out where all of their medications are in the country at any given moment in time to make sure that we can deliver within 24 to 48 hours. If you own a hospital or you work in hospitals, you know that task. But we took it on ourselves to create a platform that raises the bar of pharmaceutical distribution in this country because we deserve it. And so that is what MEDZAF is all about. You can go to medzaf.com. I don't know if it's up there, it's not up there, but it's medzaf.com, MEDSAF.com. And all you have to do is sign up. For all the AGPMPN members, I think yesterday we gave away 100,000 Naira of medications, but for all of the AGPMPN members that signed up, we're giving away 50,000 Naira vouchers so that you can purchase medications for your hospital. We also have a program, and I'm happy to do more. We also have a program called MEDZAF Assure. We have identified the top medications in this country that are fluctuating, their prices are fluctuating, and we're gonna help you lock in those prices for 3 months, 6 months, or 12 months so that you can plan and reduce your overall costs. So you really need to sign up on that program because these are below market discounts that we're giving you. And we would like all of AGPM to sign up as a group. Let's knock out pharmaceutical prices in this country. And we are happy and open to work with any state government here that wants to revolutionize pharmaceutical distribution in their state. MEDZAF is ready to work. I'm the owner of MEDZAF. I'm not representing anyone. I'm representing myself, and I'm here in Abuja for you to show you that we are working really hard. And there are companies that are not running away, but are focusing on how to face Nigeria's problems and fix it. And that's what MEDZAF is doing today. So reach out to me, I'll be around. I think you're gonna get a flyer, it has all of our information, but we are waiting and ready to work with you. And we can deliver across the country. I don't care where you are, we will get to you on a monthly basis. So thank you so much.
Thank you. Ladies and gentlemen, it's very heartwarming when you see young Nigerians committed to making this country work This is not a foreigner. She's one of us. As young as she is a huge platform that she has opened to ensuring that she contributes her own quota to medical excellence. And I want to let us know that if we want medical excellence, it's all about collaboration and synergy with the other partners, the medical lab scientists, the pharmacists. Doctors can't do it alone. Ladies and gentlemen, please, one more time, can we put our hands together for that young and vibrant Nigeria that is committed to making things work? And if we must make this country work, we have to have a rethink of the way we do things. Before we bring our professor, let me give us an instance. If we want to make Nigeria work, it has to be us. The way we think, the way we do things. They just concluded Tokyo Olympic. Let me give us a story. They just concluded Tokyo Olympic. Nigeria went with 58 athletes, 58, and 72 officials. And guess what? The 58 athletes, 10 were disqualified. And we had 72 officials for 58 athletes. And we came back with 2 medals. And the United States went to the Tokyo Olympic with 626 athletes, with 40 officials. We need to change our ways of doing things. And this is what has brought us, all of us, together at AGPMPN, because we want excellence in medical practice in Nigeria. One more time, please, let's appreciate ourselves. Let's appreciate ourselves. Thank you very much. Ladies and gentlemen, the next person I'll be bringing to the podium to make his remark is a renowned medical practitioner in Nigeria, a global brand, our leader, our father, our teacher and trainer. Ladies and gentlemen, let's put our hands together for Professor Bade Adewale. Professor Bade Adewale is the president, Complementary and Alternative Medical Association of Nigeria, and he's a Commonwealth registered acupuncturist. Please, let's make welcome Professor Bade Adewale. Thank you, sir.
AGPMP is like some of us, our mouths are on public holiday. I don't know why we are not chanting. AGPMP. Well, I will differ a bit from what we've been hearing from our speakers all along. But before then, sorry, I've been corrected. They say it's AGPMPN. Okay, AGPMPN. It means you are the true son of your father. Sorry for that, you know, I'm not a member. I was only trying to belong, you know. I hope you will accept me. I want to sincerely commend the president for deeming it fit to invite practitioners of complementary alternative medicine to this garden. This is the first time in the history of this country that this is happening. Whether we like it or not, like I want to refer to late Chief M.K. Abiola, he says, you cannot clap with one hand. The medical situation in this country calls for the concerted effort of all stakeholders, not just the medical doctors. I'm going to give 2 instances. Sorry. Some years back in Geneva, it was reported that 3 infections are currently ravaging the entire mankind. What are those 3 infections? E. coli, Salmonella, and Staphylococcus. The United States of America rolled in billions of dollars to get the right antibiotics for this, but they couldn't succeed. India got up. India said, we've been able to combat most of these diseases using our own medicine. And what is the main medicine of the Indians? Ayurveda medicine. China got up. we've been able to solve this problem using our Chinese traditional medicine. Chinese traditional medicine will include the herbal medicine, acupuncture, moxibustion, and so on and so forth. What am I talking about? In some years back, I want to refer back to sports, which the MC just mentioned at National Stadium here. An IOC delegation came to the stadium to educate us on management of sports injuries. All the lecturers that were invited were talking about all the various interventions for managing sports injuries, physiotherapy, medical therapy, and so on and so forth. Then they will put acupuncture. All the people that came were mentioning acupuncture, whereas none of them happens to be an acupuncturist. At the end of the seminar, somebody mentioned, does that mean all the people are talking about acupuncture? What is acupuncture? All of them said, we don't know anything about acupuncture. And I was in that gathering. I now raised up my hand. They now called me out to come and do just a 10-minute presentation of acupuncture, which I did. Unknown to me, the head of Sports Medicine Center, Dr. A.K. Amao, was in that midst. He now came up with this question. He said, Clemens Westerhoff has been having frozen shoulders for days. What can acupuncture do for Clemens Westerhoff? And I said, fine. I said they should go and bring Westerhoff. Before you know it, Westerhoff was brought. I was able to use acupuncture to relieve the pain and to enable him to raise his hand, which he has not been able to do for 3 months. Just one session. Everyone was dazed. What is this? Because many of them, they had never seen acupuncture before. This attitude is what we must discourage. Medical doctors should not see practitioners of complementary medicine as a threat or as rivals. We are partners in progress, and we should work together. If you want this country to develop, other aspects of healthcare delivery system should also be developed. Medical and Dental Council, in the Act of 1991, they group complementary medicine and orthodox medicine together. But if I would tell you, it took Medical and Dental Council 21 years before they could register me. 21 years. And ever since, nobody is talking about complementary medicine again. You know, that was one. In 2014, when Medical and Dental Council invited some of us to come and defend some aspect of complementary medicine, which are recognized, which are captured in the decree of 1991. What are those? Acupuncture, homeopathy, osteopathy, and naturopathy. They said we should come and defend it. While I was making my presentation, unknown to me, I cited the example of Clemens Westerhoff. What happened that time? Everybody was attentive, just as we're attentive now. Not knowing that the director of health services, Ogun State, was having similar problem. He was having shoulder pain, frozen shoulder, and a very bad waist pain. The lady now said, what you did to Westerhoff that time, please come and do it to me. All the doctors there were looking at him as, what's wrong with this one? What's going to happen? The woman told me she cannot lift her hand for almost 3 months now, and her waist, this is how she stood. I now ask her, which one are we resolving first? Is it your waist or your frozen shoulder? She said her waist. Stand up. She said she cannot stand more than this. I said, okay. I brought out my acupuncture needle. I put my needle here. All of you here, you may not understand. The Chinese call this place Aochi. That is where I put my, it's not the one in Edo State too. I put, and I'm very serious. If you close your hand like this, there is a small heel here, just by the pharyngeal joint here. See, by the metacapa here, area here. You put the needle and you stimulate it, it will immediately unlock a frozen neck and a very bad waist pain. I did that. After about 3 minutes, I told her to stand. She was able to stand erect. Everybody was looking, what was happening? The woman said, okay, you have solved this problem. What about my hand? I cannot lift it. The doctors were watching me. Then I brought out my needles. I didn't put the needle anywhere in the shoulder. I put the needle somewhere in the leg because that is the best point to raise a frozen shoulder. I put my needles there. After about 3 minutes, I said she should raise her hand. And Up it goes. She raised up her hand. Everybody was clapping. The then chairman of Medical and Data Council gave me 100,000 for that feat. So what am I talking about? This is the time for us to diversify. Medical doctors, come and learn complementary medicine. It will be good for all of us. Our patient will be best served if we know all these things. So those of us who are looking at complementary medicine with contempt, all these attitudes should stop. If we are to move the healthcare delivery system forward in this country, we should embrace complementary and alternative medicine. I am not saying you should turn to Babalawo. That's not what I'm saying. But complementary and alternative medicine are backed with science. Look at China today. Look at India. All those people who are going to India, going to all these, most of them are going there to take complementary medicine. When I was in Israel, I treated 2 Nigerian former heads of state. So it is high time we look into all this area of medicine so that we can grow. I don't want to take your time, but I think that should be a food for thought. If you want to diversify the economy of this nation, we should also encourage other forms of medicine, especially complementary and alternative medicine. My colleagues here, it will not be a problem for you if you blend complementary medicine with your practice. I am sure if you know complementary medicine, this issue of brain drain will stop. You will not like to travel everywhere because you are going to make the money. If the charlatans and quacks in networking, if they are making millions and millions of naira every day, what is wrong with 2 people that are learned? That is a food for thought. Thank you very much.
Thank you very much. We appreciate Professor Bade Adewale. Thank you very much. Ladies and gentlemen, I told you earlier, achieving medical excellence is about synergy and collaboration. It is on that note that I'd like to recognize and usher to the podium to make his remark, His Excellency Senator Dr. Nwabweze Ngige, OON, the Honorable Minister for Labor and Employment, ably represented by Dr. John O. Magadelu. Please, if he's ready, we're ready. Please, can we put our hands together for our Honorable Minister? Thank you, sir.
Good afternoon, ladies and gentlemen. I must say that I'm very glad to be here. I've learned a lot. I am not a medical doctor. I'm a civil servant, an academic. I've been asked to represent my honorable minister, who would have loved to come here himself, being a medical practitioner. He is a committed advocate of all-inclusive medicine. What Professor Bade talked about is what the Honorable Minister is also passionate about. All-encompassing medical approaches must be exploited. Dr. Chris Ngige would have been here. He had an extensive meeting on how to resolve the resident workers' strike, resident doctor strike. Up to this early morning, he was in a meeting with other government officials, Minister of Finance, several other notable personalities in government were locked up in the office, and they were looking at ways of solving the resident doctors' problem. I did a little research before coming, because coming to face distinguished audience who have been practicing this trade for years. You can't just come here as a novice. I found out that what you are doing today, which you started some 100 years ago, is a commendable effort. It's a leap forward. You want to have a committed line of funding. Private sector medical practitioners. In Brazil, they have a dedicated private medical insurance, which private individuals can access. and pay for their medical bills. We can replicate same in Nigeria. In US, it is in existence. In South Africa, it is in existence. Even in Uganda, we are much better than Uganda. So things like this should be replicated. Currently, most of the private medical practitioners are involved in delivering health services to public service workers. A good number of you here are on our NHIS, and you are drawing substantial funding already. Nigeria is not doing badly. But one thing I want to say on behalf of my minister is that this figure is too conservative. 10 billion naira, I thought dollars. How many of the established private sector medical practitioners would draw from this? It can go around. But for startment, it's okay, it's commendable. I congratulate the president of this association. I congratulate all the members for this feat. We welcome you to Abuja. Enjoy your stay in this beautiful city. Come and establish more hospitals in Abuja, private hospitals to attend to more patients. And you don't need to do medical tourism outside this country. You doctors don't also have to run away from Nigeria. Nigeria is a blessed country. All the distinguished guests have spoken about that. And I want us to leave this place convinced that we can do it, and we have to stay here to make Nigeria better than it is. God bless you all. Thank you.
Thank you very much, the representative of the Honorable Minister for Labor and Employment. Ladies and gentlemen, we have a couple of remarks, and we need to listen to all of our guests. So you will help us by keeping to the time. Just 2 minutes so that we can take as many remarks as we can. Now we'll be going to past leaders of our noble association, past leaders of AGPMPN. And the first that we'll be calling on stage to make a remark is Dr. Gabriel Oga. Dr. Gabriel Oga is a past president of AGPMPN and also a member of Board of Trustees. If he's ready, we are ready to take the remark of our past leader, Dr. Gabriel Oga. Please, can we put our hands together for him, please? Let's appreciate him, please. Thank you. Thank you.
Thank you very much, my senior and other colleagues, and members of this great association, the AGPMPN, whose centenary we are celebrating. It is a very noble idea that the current president, in his dynamism, has put this together. And for that, we should give him a hand. All over the world, the private sector is the center of healthcare delivery. The government does not do most of the healthcare delivery. If you are in UK, if you are in US, if you are in Germany and many developed countries, it's your personal physician you go to first. Let's say you have Garki. There are doctors there. People will register with the doctors. If they have any problem, they go there. The doctors will see them. At the end of the month, the government will pay the doctor. It's not a question. The government is not doing private doctors a duty if they pay for their services. The government would be doing the citizens what they need to have. We'll be giving the citizens what they need to have. They are not doing the doctors a favor. If you don't have a good healthcare system, you won't have a healthy society. And when members of the society are not healthy, you cannot have financial progress. There will be no economic progress. You see people who may be in high office, whether they be governors, ministers, every day they are bombarded by calls from the village that mama is sick, daddy is sick, your uncle is sick, it's on admission, there is no water, there's no money to pay. If we took care of the private hospitals, your uncle can be sick at Okitipupa. There's a private hospital there that will take care of him. The government will pay. That's all we're asking the government to do. And the big problem is that there is no investment money. We say that we should have compulsory universal health insurance. Now, consider the number of people that die from road traffic accidents. The males that die from road traffic accident a year for men, just about 5,000. 20,000 men die from prostate cancer yearly in Nigeria. If you can make motor insurance compulsory, so that you can take care of people who may die or vehicles that may be damaged. Vehicles, so you don't want vehicles to be damaged, you don't want people to be killed. The only people that are killed in road traffic accident, only 5,000 men. I'm not talking of women and children. If you can make vehicle insurance compulsory because of 5,000 men that will die, I say prostate cancer kills 20,000 men. Why don't you make health insurance compulsory? You will not travel on the road, you will not take a flight if you don't have health insurance. You will not send children to school if you don't have health insurance. Who is to pay? The government should pay for you. So if you are traveling from here to Lagos, you land in Lagos, you must have your health insurance paper. If you are ill, there's a hospital there for you where you'll be treated. This is all we are telling the government to do. This is not quadratic science. It's a simple thing. Why can't the government have the way? You want to buy equipment. Even while I was here, patients are calling me from my hospital. They are giving a bill because they happen to have my phone number. They are calling me that they are retired, they have not been paid. I said, look, Abuja, when I came here, when I was paying my flight ticket, I didn't tell Ibom Air that I'm retired. They just tell you, this is the fee. If I take my meal in the hotel, they say it's 5,008. I don't tell them I'm retired. You pay or otherwise you will not eat. I said, please talk to my manager and get your fees, but stop calling me, I'm in Abuja. We don't want that to be happening. We want the government to provide facilities. If you want me to have a healthcare system, if you want me to run a good hospital, let us have banks. I take a loan. There's nothing wrong with interest-free loan. The interest should be paid by government. I take a loan of 20 million and to pay back in 10 years, let the interest be written off by government because I'm providing a service. Let's have a bank where you can take such money or any other financial institution for that matter. We have said it. We have said it. Give us universal health insurance. Give us a health bank. The government will not do it. And yet, it is not difficult to do. And yet, when COVID-19 was serious, all the big men, so-called big men in Nigeria, rich people, were going to private hospital, pay millions. None of them went to a government hospital. Let everybody who knows anybody in government tell them, I don't see any prestige in it. Going to another country for healthcare delivery. Patronize us so that you can patronize yourself, so that we can provide more facilities and more appointments, employment for people, so that we reduce the level of insecurity in Nigeria. This is what we are telling government to do. We are telling the private sector who have money, who establish company. When you have money, you establish a bank. You don't tell a banker to go and have the money to set the bank. You employ a banker, give him all the facilities. He's chauffeur-driven. He has good allowance to run your bank. But when Nigerians want to have a hospital, they'll be asking the doctor, how much are you going to contribute? I'm contributing my brain. A professional is supposed to contribute his brain and his expertise, not money, because he has invested in his brain and expertise. So this occasion is a very apt occasion. It's worthy of the times, and we continue to appeal to government. They should not blame us. Oh, this hospital doesn't have that and water. How is your generator? Am I supposed to use a generator? Am I supposed to have a borehole? If you come to my village, we are in a mountain, a borehole is 8 million naira. The cost of electricity in my house is more than what you will pay for electricity in a similar house in New York. Where do you expect me to have all the money? So let the government help us so that we can help ourselves. Thank you very much.
Thank you very much. Dr. Gabriel Oga has spoken like the leader that he is. Ladies and gentlemen, listening to past leaders of AGPMPN, the next that we'll be bringing on stage. One way to know a viable organization is the presence of their past leaders in their event. You do some event, some past leaders that left in annoyance and quarrel, you will never see them. But here we are, we have two past presidents of the association. It shows how viable AGPMPN is. Ladies and gentlemen, the former president of Association of General and Private Medical Practitioners of Nigeria, may I have the singular honor and privilege to invite to the podium Dr. Anthony Omolala to make his remark. Please, can we put our hands together for him, please? Thank you, thank you, thank you very much.
AGPMPN, AGPMPN. Let me first appreciate the current president, Ambassador Dr. Aikodo, for putting together this great event. And let me also appreciate all members of AGPMPN. Even at the midst of COVID, at the beginning of the third wave of COVID, you have found it very, very, very necessary to be here. It shows commitment to AGPMPN. It shows commitment to healthcare delivery. And that's what AGPMPN is known for. Our journey started 100 years ago. Here we are today. Since I've been around since yesterday, I have been brainstorming and looking at the gains of the association for the past 100 years. One thing that has glided in my mind is we've been together for 100 years. And for that, let's give a round of applause for AGPMPN. I actually sympathize and empathize with all of you, my colleagues in the private health sector, for actually going through the kind of agony you are going through in delivering healthcare services to the population of Nigeria. One thing that I've observed over the year is that each facility is a government of its own. They provide water,
they provide power, and they provide access to road. Can we continue in this way and get to our promised land? Absolutely no. What are the ways forward? Very simple. This one-day dialogue has shown us that there are ways we will easily get to our destination. The pragmatic discussion and approach of some of the speakers can be testified to today that the only way we can go is to have a private health sector bank and not a head bank. One very big challenge that we have as private practitioners is that we don't keep our records. Assessing funds in banks is extremely very difficult. I use my own as an example. Recently, I applied for the loan to Central Bank, and it took me just 2 months to get all my papers ready until that loan was granted. Whereas I can assure you, a lot of systems in the healthcare that have kept all their records up to date, we take them just 2 weeks, they will get this loan. I want to appeal to you as colleagues that you, from today, when you get back home, have a very strong accounting and finance system that will keep your records. This will enable you to have better access to fund, even when we create a private hospital account or bank. One very good thing is that we provide the greatest percentage of healthcare, which is, someone quoted 50. I think I wanted to say that person was not current. We actually provide about over 70% of healthcare needs of all the Nigerian population. This is a segment that government needs to partner with, government needs to work with, government needs to make sure that things are made easier for us. I again appreciate and congratulate you for staying behind. If you ask 10 doctors in Nigeria and do a survey, do they want to stay back in Nigeria? I can assure you, except for people that are over 50 or 60 or 70, about 95% of them will tell you they want to check out. Check out is simple. They want to go to a greener pasture. Everybody, you cannot stop this movement. I have told government, even when I was the national president, I told government, you cannot stop movement. Movement to a greener pasture is a natural phenomenon that will happen naturally. The best way you can do is to make sure you have something very close to the advanced nations. And I can assure you, by the time you start giving what the private health practitioners need, the doctors, you start giving loan at below 5%. We advocated for grants. What is wrong in giving grants? Except we have access to funds. Money answers all things. Don't let us deceive ourselves. You need money to bring quality. You need money to touch up. You need money to expand. You need money to do everything in healthcare system. Healthcare system is capital intensive. It's not a venture that brings back all what you invest in 1 or 2 or 3 or 4 or 5 years. And this we have made sure we have told government, and government should realize that they should support us with grant, if possible, or private hospital bank where we can access money at, if possible, 2 to 3%. That is the way forward. We need to continue to press on government. We need to continue to make our voice very loud. We need to continue to agitate and go to all the corridors of power and make our voice known. I'm very sure with the current leadership that we have and with the support of all members, we are going to get to our destination, and healthcare in the private sector will be better for it tomorrow. Thank you very much.
You would agree with me that it's very inspirational listening to all of the leaders of AGPMPN. No one is better than the other. They speak fire, they speak motivation, they speak reason, they speak good counsel. Ladies and gentlemen, we'll now go into partners, people that are partners, organizations that are partners with AGPMPN. And we're going to be very strict with time. Just 2 minutes, because we're going to take 5 presentations, 2 minutes each. And we're going to kickstart this session with the representative of Prince Elochukwu. Prince Elochukwu is the president of the National Guide of Medical Laboratories Directors. He's very ably represented by Mr. Ikechukwu. Please, if you are ready, we are ready. Just 2 minutes. Can we put our hands together for him, please? We will see the Nigerians that keep to time now.
Thank you very much. Good afternoon, everyone. Our protocols are duly observed. My name is Ikechukwu Ononuju, and I'm the National Publicity Secretary of the Guild of Medical Laboratory Directors. I'm here on the instance of my boss, who is the national president of our great association. Guild of Medical Laboratory Directors is actually an umbrella body that houses the private laboratories that will stand alone in Nigeria. So if you want to put it this way, you can say we are actually the laboratory component of the private health sector. And we want to appreciate this very great program. My national president, Prince Elochukwu Adibo, has sent me to send his congratulatory message to your centenary celebration, and to also wish you a very wonderful and successful deliberations in your meeting. He also wants me to express his profound gratitude for the invitation that is being extended to him and also to our great organization. Actually, this time around, is a time for us to partner. It is not just health sector. It's not only for just one particular profession. So, Guild of Medical Laboratory Directors is actually making their own wonderful contribution in the private sector, and which is also very complementary to what this very great association is doing. So we are glad that we are part of this very great meeting. And he has also asked me to also extend an invitation to all of you, because we will also be having our national conference. The Guild of Medical Laboratory Directors National Conference is going to hold here in this ICC just next week, Wednesday and Thursday, 18th and 19th. So he has asked me to invite all of you to attend. So on behalf of my national president, I want to appreciate you all for this very opportunity, congratulate you for your centenary celebration, and wish you a wonderful deliberation. Thank you.
Thank you very much. Thank you very much. Ladies and gentlemen, without wasting time, permit me to invite to the podium the representative of the DG of NAFDAC, Mr. Bello Salilu. Please, if he's ready, we'll take his remark. The representative of the Director General of NAFDAC. Please, can we put our hands together for him? Thank you for your patience. Thank you for your solidarity. I told you earlier, one thing that AGPMPN has done is collaboration and synergy. Thank you, sir.
Good afternoon, ladies and gentlemen. I would like to express the gratitude of the Director General NAFDAC to the Association of AGPMPN for the invitation to participate in this August occasion. The Director General of NAFDAC wishes to commend the efforts of the leadership of AGPMPN for organizing this occasion and for your effort in bridging the gap that we have in the medical health, in the healthcare of this nation. So she will also want to congratulate AGPMPN on the centenary celebration of the formation of this association. And I would like to assure you of the support of NAFDAC whenever the need arises. And for time, I would like to say congratulations and God bless you all. Thank you.
Thank you, sir. Thank you for keeping to time. Thank you. Ladies and gentlemen, other partners with AGPMPN, permit me to introduce and usher to the podium the Sir Emeka Offor Foundation. They are here in their number, very ably represented by Mrs. Peter Unu to make her remark. Mrs. Peter Unu, if you are ready, we're ready to take your remark. I was thinking a lady was coming. We've not had any lady address us today, and I'm sure AGPMPN has taken note of that so that we have a lady address us, especially that our Save 1 Million Nigerian Mothers Initiative concerns lady. Thank you, sir.
Good afternoon, everyone. We are honored to be here today on such an important occasion. As the MC rightly said, we are Sir Emeka Offor Foundation. Sir Emeka Offor Foundation is a charitable, non-governmental organization which was founded in 1993 by Sir Dr. Emeka Offor himself. We stand on three core programs: education, empowerment, and health service program. Under the umbrella that we are invited today, I believe, is the health program. This is why this distinguished body deems it fit to invite us to eat one-day roundtable dialogue on private sector intervention in healthcare in Nigeria. Apart from the role CF played in the eradication of polio, CF is also involved in other causes, onchocerciasis elimination, and all that we have out there. When the pandemic struck late 2019 into 2020, the founder of Sir Emeka Offor Foundation, Sir Dr. Emeka, rose to the occasion. He procured quantity of medicines and supplies, which was distributed to tertiary institutions across the country. This was occasioned by the pandemic, which overwhelmed our our hospitals and medical centers. Today, we are invited today because of the role we have played in health sector in Nigeria. The Chief of Staff of Sir Emeka Offor Foundation will be with us tonight, where he will give a special message to this body. We hope that you have a very, very favorable celebrations today. God bless you.
Thank you very much, representative of Sir Emeka Offor. Ladies and gentlemen, the next remark will be that from the representative of Dr. Aminu Mohammed. Dr. Aminu Mohammed is the Managing Director, CEO of Venus Medicare Limited. Venus Medicare Limited is a HMO in Abuja here, very ably represented by Dr. Chidi Ubogolu. Please, can we put our hands together for him, please? Thank you, sir.
Good afternoon, ladies and gentlemen. It's our pleasure to be here. My CEO, Dr. Aminu Mohammed, would have loved to be here, but unfortunately he couldn't make it. Venus Medicare Limited, it's one of the national HMOs in the country. We started operations in 2005, extremely committed and a very worthy partner of the private medical practitioner of Nigeria. But most of our healthcare delivery, most of our hospital network is riding on the private sector. We are providing assistance to the National Insurance Scheme in the public sector to ensure that healthcare financing and administration is carried out for the benefit of all the enrollees. I just want to quickly just run through the very short goodwill from Dr. Aminu Mohammed. On behalf of myself, the entire management and staff of Venus Medicare Limited, we heartily congratulate the Association of Nigeria Private Medical Practitioners on your centenary celebration as an association, as a major stakeholder in the Nigerian healthcare industry. Your contributions in the provision of healthcare to the Nigerian people and advancement of our healthcare system is evident to all. In a system where the government is unable to meet all the needs of the population, private sector support is extremely crucial. It's no doubt that the Nigerian private doctors take care of needs of over 70% of the Nigerian population, and therefore can be said to be the largest provider of healthcare in Nigeria. We cannot be wrong if we conclude that without you, our healthcare system will collapse. Over the years, you have always been at the forefront of championing courses for improvement in our health system. You have always engaged the various regulatory authorities in our health system, challenging them to create new policies or adjust existing ones that will foster advancement and effective healthcare delivery. In the health insurance industry, where we are an important stakeholder as an HMO, we recognize your specific contributions over the last 16 years since the launch of the National Insurance Scheme. You have challenged the HMOs and the NHIS. We have sometimes disagreed vehemently on areas of divergent views, but have always come to a mutual compromise for the benefit of the healthcare consumers and enrollees. Your commitment to condemn and to checkmate some of your erring members who engage in practices that are not healthy in our industry is well recognized and appreciated. As an association, we know that you stand for integrity, equity, and promotion of acceptable standards. Your recent conferment of merit award to Venus Medicare Limited for our outstanding contributions to the development of the health insurance industry in Nigeria goes a long way to show your commitment to promotion of good standards in our health system. You conducted an independent, unbiased evaluation audit without our knowledge, and you came up with relevant criteria to determine the awardees. This is indeed encouraging, and we thank you immensely for the recognition. This has motivated us to ensure we continually improve our operations to much higher standards. This move to bring together the various private sector participants in the dialogue of advancing the healthcare delivery system in Nigeria is a welcome and commendable development. We want to assure you that Venus Medicare is committed to do its part in ensuring that the goals of this initiative is achieved. We will do our part, and we shall communicate in due course all the areas that we intend to provide support. Once again, we thank you very much for exemplary performance and many congratulations for the great milestone of your 100th year of existence. Thank you so much.
Thank you, thank you. Ladies and gentlemen, the next that will be inviting to the podium is Dr. Iseko Iseko. Dr. Iseko Iseko is a consultant cardiologist from the Cardio Care Multi-Specialist Hospital. If he's ready, we will take his remark. Thank you, sir.
Good afternoon, everyone. All protocol duly observed. We are very glad to associate with this great society on this occasion, and we want to congratulate the EXCO and all the members of this great society on this milestone. And I want to say that we are fully behind you as members of the Limi Hospital Group, of which Cardio Care is a member. Nothing rises by default. Everything rises by design. And anything that you don't put a deliberate design to eventually decays. The steps that this organization and this body has come to put together in taking a bold step of holding healthcare in Nigeria is remarkable. McKinsey's report puts private healthcare as providing 75% of all healthcare in Nigeria. That's a 2016 report. That means that we literally hold the thermometer of healthcare in Nigeria. If we say Nigerian healthcare is good because private healthcare is good, if we say it's bad because private healthcare is bad, and we are the epitome of that institution, and I want to congratulate everyone here present from the Limi Hospital Group, which consists of 3 hospitals here in Abuja. The Limi Multi-Specialty Hospital is a multidisciplinary hospital in specialties from ENT, dermatology, family medicine, all the specialties. The Cardio Care Hospital is a flagship hospital that is set to reverse medical tourism, and essentially we do dialysis, we do cath lab services, we put pacemakers, stents. So if you're having a heart attack anywhere up from the entire northern Nigeria, Cardio Care will be your best bet instead of having to travel abroad. And the Limi Children's Hospital, which serves as a pediatric multi-specialty hospital in providing particularly NICU services. These are private healthcare institutions that are rising to the podium of providing advanced healthcare with the support of AGPMPN, whom we have been a member of for several years, over 10, 20 years. We have been members and active members here in Abuja. We want to congratulate the EXCO once more and everyone here present. Thank you once again for giving Limi Hospital Group and Cardio Care the opportunity to be here and to put all our hands together to determine that healthcare in Nigeria must prosper. God bless you.
Thank you very much, Dr. Iseko Iseko, consultant cardiologist from Cardio Care Specialist Hospital. The next remark that will be taken is that of Dr. Ekine Ekena. Dr. Ekine Ekena is the managing director of Ekena Natures, traveling all the way from Enugu State just for this event. Ladies and gentlemen, please can we put our hands together for Ekena Natures? Thank you.
Good afternoon, everybody. All protocols duly observed. Well, it's my heart desire to give us a little idea of what may help all of us. I'm a pharmacist by training, but I've deviated a little in practice. Just as the name of our company denotes, is Ekena Natures Limited, Enugu. Well, I'm not here just to make a claim, but I want to send an idea to all of us. There's an area we have left behind, and others have captured that area. That is area of natural medicine. I wish you would just listen very well. We have left a virgin area to those who are not qualified for it. You can wonder why a pharmacist practices natural medicine. And I'm not here to make claim, but I'm sure we have underrated the efficacy of natural medicine. We have underrated it. I will not blame anybody because personally me, in the study of pharmacology in UNN, little was said about phytopharmacology. It's possible also in the profession of medicine that not much was said. Drugs that we call the isoflavones, the campherols, the luteolins, it's hard to synthesize them. But a little drug which you can get from onions, simple onions, alpha-lecithin, the efficacy is something you cannot believe. So when we made a very big claim that cancer can be cured, it sounded very incredible. But when I applied for patent right from federal government of Nigeria, I was asked to defend my claim. I did, and I was given patent right. I was given patent right that there's cure for cancer. There is cure for diabetes. I have my patent right. In fact, the president, Dr. Odo, knows me, knows my center. And he personally invited me. So I think we're underrating areas. No, we're underrating areas. I don't think there's anybody that can practice natural medicine more than you, doctors. It's a matter of giving little attention to those drugs, implants, which we don't know much about. First, there may say, take this plant, take this plant. But no, talk about the active constituent in that plant. Learn about the pharmacotherapeutic properties of that agent. They are going to record a result that you can never believe. So I'm here for this centenary celebration. Adding that, we should believe and also understand the efficacy that comes with natural products. I think the quest for money, the federal government giving you money, loan from bank, it may stop. Because out there, who will come for degenerative diseases? I think natural drugs have more answer to that than any other thing. And I think people are waiting for us there. Let us stop any bickering, any interprofessional struggles, or any kind of misunderstanding amongst professionals. Let us solve the problem of the patient. And that is knowing the right thing to give to them at the right time. I believe that if we do it, a lot of cases today that will label management diseases can be cured. I approve of them. And the only solution actually is understanding the constants of natural drugs implants. Thank you so much.
Ladies and gentlemen, thank you very much to our pharmacists. Thank you very much. Ladies and gentlemen, the next remark that will be taken will be that from Dr. Patrick Nwobodo. Dr. Patrick Nwobodo is a medical entrepreneur flying all the way from Enugu State to grace this occasion. If he's here, we will take his remark. Okay, thank you. I think, ladies and gentlemen, please can we put our hands together for Dr. Patrick Nwobodo, a medical entrepreneur from Enugu State. Please can we appreciate him, please? Thank you, sir.
Good afternoon, ladies and gentlemen. I want to appreciate AGPMPN for this milestone. It's not easy to celebrate a centenary. And we have listened to most of the presenters. Money, they say, is the root of all evil. But without money, you can't do much. even the Vatican cannot be maintained with only the Hail Mary. Money is needed. And I want to appreciate those who have made useful suggestions. The government cannot but take AGPMPN seriously. If that is done and the Hospital Development Fund is actualized, it will go a long way to make our practices very easy. Dr. Kenna that just talked is my neighbor. His outfit is in Rehab Road, where I live. And I think we'll try to look into what he's doing. I want to encourage us, like it's been said by different speakers, documentation is apt. We have to show in statistics what we are doing so that when there's an opportunity to access funds, we'll be able to present the necessary documentations. Once again, I want to congratulate AGPMPN for the beautiful work that we are doing. Thank you.
Thank you, thank you, thank you very much. With that, we have come to the end of the remark. And as a finishing touch, we wish we can go on and on and on. But this is where we draw the curtain to the first part of our celebration for today. We still have a dinner and all of that. Ladies and gentlemen, the next item on our agenda All right, so the next item on our agenda is going to be reactions and interactions by guests. Please, for sake of protocol, if there's anybody, because we expected our guests from the east, the south, the west, and even the north. If you are a guest and you're here in any representative capacity and you've not been recognized, or you have a remark to make and you've not been recognized, to that effect, just kindly draw our attention so that we can do justice to that. Meanwhile, while that we await that, we're going to take reactions and interactions by guests. So we just leave that room open. If there is any reaction, if there is anyone that we've not recognized, please do well so that we can capture that aspect of the program. Then after that, we go into the goodwill messages, which we have already taken. And following that, the launch for the 10 billion intervention fund. I told you the program is a continuum. We're going to continue with all of that. Then we still have an interlude of music. Our cultural troupe, if you are ready, we will take one more cultural troupe to entertain our guests. All right, so we'll take one more cultural troupe, a performance from the cultural troupe. Please, all of our members and our guests, our invited guests, we have a dinner right here by 6 p.m. 6 p.m. If we are leaving, it's just to go and freshen up and return back. Same venue. The dinner and the awards by 6 p.m., same venue. 6 p.m., same venue for dinner and award. All right, so we have listened and watched the Yoruba cultural dance troupe. We've also listened and watched the Hausa Fulani. So now, what do we have? The Igbo cultural display. Ogene. If you are a true son of your father and you want to join in the dance troupe, the stage is open for you. Thank you, thank you, thank you, thank you very much. Thank you very much. Thank you. Thank you, thank you, thank you very much. Please, can we put our hands together for them? Thank you, thank you. Ladies and gentlemen, this is where we draw the curtain gradually. You will agree with me, it's been a fruitful time, very rich discussion. You would agree with me, it's been a fruitful, very rich discussion by the various speakers, and it's been a warm moment charting the way forward. And we hope, we pray and hope that our leaders and government at all levels will look at what has been discussed here today, especially with looking at a package, a rewarding package for the private medical practitioner who continuously stands in the gap when is most needed, when is most important. And we cannot leave this very important sector of our nation's life, the private medical practitioner. And again, we also hope to look at government long-lasting solution to the various problems bedeviling the health sector. I know more discussions will come up, especially with housing funds for private practitioners. You need to live in a roof where you practice. It makes a lot of things easy. And many of these, we hope we get a positive response by our government. Ladies and gentlemen, one man that will continue to appreciate for putting all of this together, assembling all of this resource person, is no any other person but the president of AGPMPN, the man who is everywhere, making sure that our one-day roundtable dialogue is a huge success. Ladies and gentlemen, one more time, please can we put our hands together for Ambassador Dr. Ugu Ike Odo. Please can we appreciate our president? Thank you, thank you, thank you very much. And you know, for every dispensation, you also need to have supportive ESCOs, supportive executive. So it's not just the president, the secretary, other executive members that have played one role or the other to making sure that we have the success that we have today. We appreciate all of the executives of AGPMPN. Ladies and gentlemen, standing right here with me is the Secretary of Association of General and Private Medical Practitioners of Nigeria. Please, may I have the singular honor and privilege of introducing Dr. Ned Okoro. Please, can we put our hands together for the Secretary General of our noble association, who will be giving us the vote of thanks for this event.
Thank you very much, Mr. MC. In fact, VP1, don't go anywhere. VP1, come back. Come back. We never finish. MC, in fact, the way you are dissecting the whole of this topic, we're going to find out where you are doing your residency. Mr. President and Council, members of the National Officers Committee, distinguished delegates, members of AGPMPN, it's my privilege once more to say a very big thank you to every one of us, especially those of us that have remained behind until this very last moment. We are very grateful to you. We appreciate you for honoring this occasion. And let me remind us again that by 6 p.m. this evening, we are convening here again. All members of the National Officers Council, my VP1, Saki, WLO, IPSG, everybody that is still in the house, AGPMPN members that are still on ground, thank you so much. Thank you. And our spouses that remain behind, we really appreciate you. So, and the Communique Drafting Committee, really, the Secretariat, the National PRO, the pictures, everything has been great. The sound people, we thank you all. Thank you very much. See you again by 6 p.m. MC, thank you. You did a wonderful job. A round of applause for the MC. He has really tried. Let me and you go share your money.
No Allah, no Allah. While accolades are given to the MC, I'd like to appreciate the effort of Associate Doc Nick. Mr. Nick was the one who gave me this opportunity. Thank you so very much, Mr. Nick. My name is Dr. Abba Innocent Uchigbo. I'm a resident doctor with the University of Abuja Teaching Hospital in Gwagwalada. Thank you, thank you, thank you very much. We will stand to take the Nigerian national anthem. So, just a quick reminder, 6 p.m., same venue, it's the dinner. And honestly, sorry, 1 minute. Doctors, this is our dinner. AGPMPN members, this is our dinner. So we must go change and come back for the dinner. And honestly, if you're coming to dinner and you're coming alone, it's very boring. So you need to get someone, your wife, your fiancé, anybody, so that's how to come to a dinner. Don't go to a dinner alone and go with your suit or your kaftan. Thank you. The national anthem. Thank you, and see you by 6 p.m. Same venue, same audience. Thank you, AGPMPN.